Now we're going to do a visual and physical assessment of the scar. So before we do anything, we want to take a look at the scar, and we're going to look first at the color. So I have been touching the scar a little bit, so it's a little bit more pink than it usually would be, but we're seeing that pink, which is that sign of inflammation, and a lot of that like more white. We can see certain spots are a bit lighter, certain spots are darker. And thinking about some of the puckering here, how there's a bit of a dip here. So this dip would indicate adhesions and restrictions underneath. We also would want to look at the shape of the scar. So it has this little through line here. So there may be more tension up here at the front, kind of pulling this part forward. Or it could be that there's a bit of tension pulling this part back. That's something that we would learn more as we start to do our hands-on assessment. Again, we see this puckering here, and we see how there's a big change in the visible texture from the top to the bottom of the scar. We also see these little offshoots. These are likely from staples from when it was healing. And we can see that there's a little bit of extra here. And we're like just extra tissue buildup, a little bit more of a raised spot there. We'd also look to see how flat the scar is. So there are certain spots that look raised, but overall it has pretty good appearance. It's pretty good, pretty flat, which is good, but we can visibly see that there are certain pulls. So you can see that there's likely some tension here. This shoulder is quite raised off the table. We would also want to make sure that we are thinking about the forearm as well. Hers is flat on the table, but if it were raised, we would then want to assess to see if potentially that is related to tension coming from the scar. So now we're going to do the physical, the hands-on. So I would come in and I would come across to see if it's raised, if it's flat, just to confirm that. So it is a bit raised. Overall, it's quite smooth, but we can feel, even more so than we see, we can feel the puckering here, and that it's quite thick underneath. So even though it isn't raised up, we can feel that it's quite dense, which suggests that the scar tissue is quite deep. So then we would also want to try and move the scar so we can see, we get a bit of a roll here. So there's potentially a little bit of adhesion there, but overall it moves quite well that way. This way we can see everything kind of bunches here. We don't get a lot of movement. This is a little bit tighter than going that way. Less restriction forward here, a bit more back. Kind of the same the whole way along the scar. The other thing when we're doing that we can watch for, we can see that there's a bit of pull through the other tissue here and a bit here, but not much different. So if we were to test somewhere that doesn't have scar tissue, it's not too different here. But when I come to the top, we can actually see it pulls the whole scar as well as into the chest. So we don't get a lot of movement going forward, but there's a lot of pulling and tension on that skin. And then coming back, we can see that that pull goes quite far into the chest, as well as kind of pulling that whole scar up, whereas we don't get as much of that in other areas. So really thinking when we're doing this about depth and about pulls and how all of this is going to kind of play into our bigger treatment plan when we get there. You can also try to lift the scar. Hers lifts quite nicely, but I can feel, so if I come really narrow, it lifts nicely here, but if I were to try and come a little bit wider, I can feel that that deeper scar tissue that I was talking about really restricts that, and you can actually see it starts to have a little bit of a dip there. Whereas with other parts of her arm, we're not getting that. So picks up a little bit better up at the top in the sense of being very even, but still has those big lines of pull. Whereas here, you get that flattening, that divot in the middle there. So just all these things to watch for as you're working with scar tissue. And some scars you won't be able to pick up at all, but trying to will give you an idea of potentially how deep it is, where the pull is going to be, and areas that you can look at as you start to get into your treatment.